Therapy dudes, take away your stress, put you in a good mood. If you had them over, they would eat up all your food. It's time for therapy dudes.
What's up, everybody? This is Dan Fox. I am one of the therapy dudes. My better half, Andre Karkamaz, is out for one more week. I miss him dearly. We will persevere. This week, I'm going to focus on CBT and DBT understanding and associated skills. We're going to do that in two podcasts. We're going to start with CBT today, and the next podcast is going to be on DBT skills. Shout out to Boulder Psychological Services, which is a sponsor of Therapy Dudes. They are awesome. Check out their website, boulderpsychologicalservices.com, for therapy resources, therapy options in the Boulder County area, and really all your therapy needs. So, I'm sure that, for many of you, this is a review. We're going to be going over what CBT is and some of the basics around it. And, if this is familiar to you, hopefully it's going to still have some additional insights to it. But, if you find it repetitive, check out the one on the DBT skills, which is next, and skip ahead if these aren't that useful. But I think they probably will be on some level. So here we go. CBT skills are based on this idea that we can look at our cognitions and behaviors, right? So cognitive behavioral therapy is what CBT stands for. We can look at our cognitions and behaviors, and if we see patterns that we don't like, we are able to, kind of in a scientific method approach, have a little experiment where we brainstorm what we might do differently with our thoughts or our behaviors, and then we try it out and see what happens, so that these patterns in our thoughts and behaviors that we don't like can be worked on and addressed, and that we do that in therapy. But ultimately, I think in the best therapeutic situations, we're able to internalize this strategy and use it throughout our life in situations that come up. An important concept around CBT therapy is that we're actually breaking down an emotional experience, not just into the thoughts and behaviors, but into the feelings. And a feeling could be, things like anger, sadness, loneliness, boredom, joy. But it could also be something that we're aware of on a sense level, our sensations, how things feel physically, what we're hearing, what we're seeing, and occasionally taste and smell. So we want to be considering our thoughts, feelings, and behaviors when it comes to an emotional experience. And in particular, one that doesn't feel good, one that we're uncomfortable with. A lot of times, if we are going through an emotional experience and we don't like it, by changing a thought, a feeling, or a behavior, it can change the whole emotional experience. So CBT is about being able to manage our emotions through, intentionally affecting our thoughts, feelings, and behaviors. And if we look at the skills that are involved, the skills break down into two categories. One are awareness skills, and these are practices or tools that help us to get in touch with noticing our thoughts, noticing our behaviors, being aware of what's actually happening. Noticing what our feelings are, what our sensations are. Sometimes, just seeing what's going on in the environment can be really helpful as a way to understand what might be, triggering us or making us feel uncomfortable. So we need to be aware of what's going on before we can actually, use the right tool to address it and hopefully, alleviate some distress or just put us in a more focused place or, get the results that we want with our experiences. So that second category is about management of whatever's going on. So we have this category of self-awareness tools and then self-management tools. Um, I like for the thoughts an awareness tool that's called the 3 minute meditation. It's where we spend 1 minute just focused on, eyes closed, breathing, sitting in a comfortable situation, just focused on internal sensations. We might be able to notice our breathing. Sometimes we can tell what our heart rate is. We can notice gravity and how it's affecting us, if we feel hot or cold. What we're noticing in terms of sounds around us. So all of that is just noticing our sensations. The second thing that we do in minute number 2 is to notice what is outside of us. So now we're opening our eyes and becoming aware of our environment and what's happening. We could notice colors, we could notice movement, other people, things that have a association to us, either positive, negative, or neutral, that we feel they're good or bad about. Um, all that is just the outside. So we have inside our inner sensations, outside what we notice in the outside world. And then the third minute is about noticing our mind and what our mind is doing. Gestalt therapists like to call this the inside outside upside down meditation because we're doing our inside sensory experience, our outside sensory experience, and then they make this joke about how our thinking, our cognitions, tends to be the problem. So they call that the upside down part. Um, Typically, our thoughts are what are bringing us some level of distress, and it might be overthinking, might be distorted thinking, it might be some aspect of not being at peace or acceptance with our experience, and just being able to notice that is a useful thing. So that's minute number 3. And that's just an option for building awareness. We can do this with feelings and behaviors as well, not necessarily in a meditation technique, but in just kind of being cognizant of what feelings we're experiencing, what behaviors we either just finished doing or are doing currently. If our nervous system is activated, that can be, both something that feels like involuntary behaviors, but also feelings or physical sensations. And to really be able to dial those things in helps us to break down this emotion into more workable parts where we can address one of these parts in a way that might impact the whole experience. So being aware of what level of, you know, um, whether it's behaviors, thoughts, or feelings, how we're doing really makes a difference in terms of our ability to then understand um, what to do to kind of manage the situation. I have a stress scale that I like to use. It's on a scale of 0 to 5. Sometimes I see it as like how many alarms for this fire. If I'm at a zero, I'm calm. I'm in the flow with an activity. I'm truly relaxing. My mind is steady. I might be walking the dog, move my body physically, doing some yoga or basketball, going somewhere with family or friends. There's no stress there. Level one, I'm experiencing low level agitation, being a little like restless, listless, randomly clicking on my phone. I might be feeling like there's something specific that I should be doing, but I'm resisting that. This could happen when I wake up in the morning with no plan for what to do with myself. Um, Often it happens if it's the afternoon, I've gotten a lot of things done, but now I'm transitioning to a structured part of my day into an unstructured one. I don't know what to do with myself. I'll often experience this low level agitation. Level two is annoyance. In this case, I'm usually struggling with accepting whatever my circumstances are. So my kiddo might need a ride somewhere and I don't want to do it. The dog might be barking and is not going to stop until someone gives it attention. Um, I have to be social in a situation where I don't feel like it. There's just something in my immediate experience that I'm at odds with, not accepting it. Uh, Level three on the stress scale is where I'm actually getting pretty stressed. I'm actively worrying about something. I'm starting to become desynchronized from my body and much of my environment. For me, this often happens if I'm going over finances and just, dealing with money, paying bills, doing billing for my work, or working on my to-do list and kind of resisting getting stuff done on the list and having the list sort of feel overwhelming because there's too many things on that. Um, could also come up if somebody, in my immediate circle is, acting out in a way that is pretty triggering. Level four, now I'm falling apart. I'm noticeably distressed. Other people can sense this from my body language. My body is definitely feeling tight or heavy. Usually multiple stressors have piled up at once, and that tends to just kind of start me spinning, and I'm getting pretty dysregulated and uh, sped up. At a level five, this is the five alarm fire, the top of the scale. Now I'm freaking out. I am unable to properly control myself. I can't really think straight. I'm probably saying things that I'm going to regret later. Um, I often have anger towards myself or someone else in these situations. So being able to know where I am on that scale, if I'm experiencing distress, is really useful because depending on where I'm at, will indicate what kind of intervention I'm going to want to be doing. So self-awareness is really important for self-management. Um, there's a final tool that I want to talk about in terms of self-awareness, which is rehearsal. And this is about just taking our day or a part of our day and just kind of imagining what it's going to be like going through it. So we're just trying to be aware of what's coming in our experience so that we can anticipate how we might be experiencing things on an emotional level, what our thoughts, behaviors, feelings, sensations are gonna be. And by doing that, we can kind of be more proactive about self-care or having strategies when we're in that situation so that we're not already triggered and then trying to just be reactive to the situation and calm ourselves down. Um, so the second category of uh, CBT skills is the self-management part. And self-management can come up in a lot of different ways. But basically, now that we, really have an understanding of what's going on through our awareness practices, we want to choose a tool that is going to help to change our experience. We want to brainstorm what might be useful with our thoughts or behaviors or feelings to be able to make something experienced a different way, make us experience it a different way. So often, some of this is just simple tools in the moment, giving ourselves some positive self-talk, doing a breathing technique. My favorite one that I've done with myself many, many times, especially in my 20s, I probably did this about 10 times a day for a few years. I would say quietly in my own mind, as I count from 1 to 3, I find myself becoming twice as relaxed as I am right now. And I breathe in and say 1, breathe in again, 2, breathe in a third time, 3. And if I felt like I still was pretty triggered, I would just repeat it. As I count from 4 to 6, I find myself becoming twice as relaxed as I am right now, and go 4 through 6 with 3 more deep breaths. There are other breathing techniques. Box breathing or square breathing is one of them that can be really useful. That's about slowing down our breath so that we can manage a situation much more effectively, because as we slow our breath, we are kind of resetting our nervous system into a more relaxed place. If we can take 6 or 8 deep belly breaths a minute for 2 minutes, we're going to be resetting our nervous system into a relaxed place. The challenge with that is if we're really distressed, sometimes it's hard to do that for 2 minutes. TIP is a nice acronym for temperature change, intensive burst of exercise, paced breathing, and progressive relaxation. These are 4 techniques that we can use when we're pretty panicked, pretty elevated. 4 or 5 on my scale. And all of these are research-based techniques that tend to work for a lot of people. They all are about interrupting whatever is going on in our mind with a physical action that is going to reset our nervous system back to a calm place. So a temperature change can be putting cold water on when we're in the shower. Sometimes holding an ice cube in our hand and letting it melt, not to the point of, pain or frostbite, but just so that it's kind of captivating our awareness. There's something about that temperature change that sort of takes priority in our brain, and we end up focusing on that instead of on whatever, our mind was overthinking. An intensive burst of exercise can be for a minute or 2. It can be doing jumping jacks, jump rope, going up and down stairs, um, a little a little yoga, especially if it's, something that has some movement in relationship to doing like a handful of poses. Doesn't have to be long. We just want to get our heart rate up a little bit, get the blood and oxygen flowing. That'll put us in a different state of mind. Paced breathing, like the technique I mentioned, and also box or square breathing is useful there. And progressive relaxation is about, starting from our head and going to our toes and progressing through the major muscle groups, squeezing them for a few seconds and then relaxing them for a few seconds. So squeezing all of our face muscles for a few seconds and then relaxing. Typically doing that 2 or 3 times, then going on to our shoulder, chest, upper back muscles, squeezing those and relaxing our arms all the way down to our feet. And usually at the end, we do our whole body and then relax, do that a couple of times. Often at the end of the day, this just helps to kind of discharge any extra energy and get our nervous system relaxed again. There's other things that are typically utilized in the self-management category, particularly around cognitions. There's a great book called Feeling Good that is all about identifying cognitive distortions. Um, Things like black and white thinking, all or nothing thinking, awfulizing, mind reading, which is where we assume we know what somebody's thinking without checking in on it. And the purpose of being able to identify these cognitive distortions in our thinking is to follow them up with a more appropriate, more realistic thought that helps us to be less extreme in our thinking. If we do this a little bit, we'll notice that there are some patterns of when and what kind of distortions we tend to use based on whatever's going on in our thinking or in our environment. And we can have on the ready these cognitive reframes, these corrective thoughts that will help us to just settle down and be less kind of out of control with our overthinking and speed of our thinking. For me, often just flip-flopping the thought, it's like, oh, this is never going to work. I'll tell myself, well, hey, this might work out at some point. Eventually, this is going to get sorted out. I might need to take a break, but I don't try to like magically come up with the perfect cognition when I'm already distressed. I just sort of flip-flop the thought and try to consider that one. And often that just helps to get a little more balanced thinking. When it comes to behaviors, people often do opposite action. So, if it's like, all right, I'm feeling stressed, I'm not going to do my homework because it's stressing me out. We recognize that that behavior is probably not going to help, and we try to do the opposite. If our tendency is just to want to scream and run off from the situation, we try to keep our voice calm and hang in there. Um, the last technique that I want to talk about, which has been really useful for me over time, is about tracking what's going on. We could call this journaling, recording our thoughts, but it's a great tool to be able to write down whatever we're experiencing or whatever we've recently experienced in a difficult situation, and to try to have some understanding as to what the thoughts, feelings, and behaviors were that generated that, with an eye towards then considering how could I manage this in the future? Is there anything about my thoughts or feelings now that I need to kind of address to be more accepting of the situation? I tend to do this personally with my phone. I just do voice to text and write myself a little email about what's going on because I talk faster than I can type, and it just seems to flow better for me when I can do that. Um, there are a lot of CBT skills and tools. You can Google this on the internet, and there's a ton of them out there. But the overall idea is to be workshopping this stuff when we recognize that we have a pattern that we don't like in our emotional experience. We want to kind of break it down, get a better understanding of what's going on, more self-awareness, and then brainstorm some kind of corrective thought or behavior or feeling that we want to be experiencing, and then test it out and troubleshoot the results, see what happened there. Over time, this is a great way to manage the extremes in our emotions throughout the course of our days and weeks and months and years. And it's a strategy that I think um, can bring us a sense of confidence and control over our life when without something in place, we're often overwhelmed and end up escaping difficult emotions with grabbing our phone and just clicking on whatever it is that we click on, or escaping with a substance. Both of these things tend to push the problem down the road. We're not actually managing our emotions. We're not actually aware of them in a detailed way. We just know that we're uncomfortable. We don't like the feeling, and ultimately we need an escape. If we don't have a management plan, if we don't have some kind of CBT approach, then when something gets sufficiently uncomfortable, we're going to escape. So let's try to face this stuff head on. You're already doing this when you're managing your emotions. It's just that it might not have been sort of broken down quite this way that CBT structures things. But there are areas in your life where you're already an expert at this and have been getting good headway and progress and success. So keep it up. I hope this was useful. Like, subscribe, comment. Thanks for listening. And the next one's going to be about DBT understanding and the tools and skills associated with it. Have a good one.
Therapy dudes, take away your stress, put you